Second group of muscles of today's class are the lateral rotators of the hip. The name is screaming the action for you, right? So they lateral rotate the hip. All of these muscles, let me show you. We have 6 muscles. My mnemonic to remember these muscles is P-go-go-Q. P-go-go-Q. Do you know what it is? It is P for piriformis, gemellus superior, obturator internus, gemellus inferior, obturator externus, and quadratus femoris. Okay, so gemellus first the superior, obturator first the internus. These muscles, as you can see, they're located deeper to the gluteus medius and gluteus minimus. Okay, so this is the deepest layer. As you can see, all of them has as a common action right here to extend, to lateral rotate the extended thigh. So your thigh right here, can you see? Okay, thigh is extended. Okay, let me flex the knee so you can see it better. So this is lateral rotation, right? Check your videos. Lateral rotation. If your knee is extended, well, you cannot see it, but you just move your toes laterally. Okay, so that's lateral rotation at the hip. But they are also synergist to gluteus medius and gluteus minimus to abduct the thigh. Okay, so that's the common action. Innervation is almost common too. All of them are innervated by the spinal nerve coming from the segments between L5 and S1. So it's L5 S1 nerve. We have 2 exceptions, and these muscles are monogrammed. Like, piriformis is innervated by the piriformis nerve, and the obturator externus, only the externus, is innervated by the obturator nerve. Remember that nerve? Innervating the medial compartment of your thigh, the adductor group of muscles of your thigh. That's regarding to the innervation. Look at the insertion. We have so many common things in here. There are 6 muscles, but almost everything is common. Almost all of them are going to attach somewhere. I don't really care where, but on the greater trochanter of the femur. Actually, quadratus femoris is very close, you will see, to the greater trochanter of the femur. So let's see these origins and insertions. Now, I have included, this is a posterior view of the hip joint. So including the sacrum, both of the coxal bones, and both the femurs, okay? To show you the origins and insertions of these muscles, the lateral rotators of the hip. So remember, P, go, go, Q. So let's start with the first P, which is piriformis. Now, again, this is a posterior view, but piriformis, is originates on the anterior. So it's on the other side of the sacrum, anterior side and lateral side of the sacrum, like about here, okay? And from here, it goes to the greater trochanter of the femur. So it's crossing posteriorly the hip joint. So it can lateral rotate the thigh as long as it's extended, okay? So that's the piriformis nerve, more like that, something like this. Okay, then the next is the first G. The first G is for the gemellus superior that originates here in the ischial spine. And from here, again, to the greater trochanter of the femur. Done. The next one, another color, blue. Let's describe the obturator. Remember, first the internus. So obturator internus, remember that this bone, the hip bone, is located like that, okay? Not like this, so we don't have a front and back. We have a medial and a lateral side. So the obturator internus um, originates on the medial side of this bone, right where the obturator foramen is. Now, this obturator foramen is covered by almost completely by a membrane, the obturator membrane. This muscle, the obturator internus, attaches to the medial side of this membrane, and some part of the pubic bone, part of the ischium, and all of this rim of the obturator foramen. And from there, where are we going to? Again, greater trochanter. As you can see, well, I'm drawing it like that, but most of these muscles are overlapping. I'll show you later. Now, the next is an O, right? So we have a G, gemellus inferior. And gemellus, gemellus inferior originates on the ischial tuberosity, and from there, again, to the greater trochanter of the femur. Then O, obturator externus. How do I put it? Obturator externus, that's the same as the obturator internus, but on the lateral side. Okay, so it's outside, the other side, but it's doing the same. Part of the pubic, part of the ischium, the rim of the obturator foramen, and the obturator membrane. Okay, but laterally, on the lateral or outer surface of this bone. And again, from there to where? The greater trochanter of the femur. Last but not least, we have the Q, the quadratus femoris. That originates on the ischial tuberosity. Remember, that's where you're sitting on right now. And from there, not now to the greater trochanter, but a little bit posterior and inferior to that, or distal to that. And this is called the intertrochanteric crest. Is this ridge between greater and lesser trochanter, and it has the shape of a quadratus, of a square. Okay, so that's your quadratus. Now, I want you to know the quadratus femoris. I want you to notice something. Let's see, maybe in green we can make a statement in here. Do you remember the name of this notch? The greater sciatic notch. So in here, the beautiful sciatic nerve is passing through. It's formed by the branches of the sacral spinal nerves, and those nerves form the sciatic nerve. And the sciatic nerve passes through the greater sciatic notch, right superior, okay, to the piriformis nerve. Piriformis muscle. So in here you can see the muscles, right? Again, gluteus medius and minimus, then piriformis, gemellus superior, obturator internus. This is the gemellus inferior, obturator externus in here, and quadratus femoris. And look at the relationship of the sciatic nerve. It begins, or the sacral spinal nerves exit in this area. See, and look, it's located right almost in the middle of the buttocks, right? That's the origin of this nerve, and it can sometimes exit right here on the greater sciatic notch, on top of the piriformis, sometimes under, in between the piriformis and the gemellus superior. Usually when in any of these locations, it can be contractions of these muscles, spasms, or irritation of the piriformis nerve can compress the sciatic nerve and cause a sciatica. That pain, well, I'm not going to tell you everything because we're going to discuss that in class, but I just want you to see that the sciatica can also be caused not only by problems with the nerve, but by problems with the muscles surrounding the origin of the nerve. Okay, and in here, I just put this because we're going to use it for the next group of muscles to describe a little, now that we're here, the sciatic nerve. So see, this is the the sacral plexus. Okay, so these spinal nerves uh, form the sciatic nerve. The sciatic nerve, as I told you, passes through the greater sciatic notch, descends on this is a posterior view, so in the posterior aspect of your thigh, okay? And this is changes, but usually like 5 inches, okay? Sometimes it's distal, but it branches, okay? And it has two main branches. The innermost branch is the tibial nerve, and the lateral branch is the common fibular nerve. This common fibular nerve distally, as you can see in here, it branches again into this is the um, superficial fibular nerve, and the other one that goes to the anterior aspect of the leg is the deep fibular nerve. Okay, so again, sciatic nerve splits above the popliteal area into two branches. The medial one is the tibial, the lateral common fibular nerve. Tibial descends through the posterior aspect of the leg. Common fibular branches again. One branch is anterior, that's the deep fibular nerve. The other branch is lateral, and that's the superficial fibular nerve. Okay? See you in the next video. We're going to describe the last group of muscles of this class, which are the hamstrings. See ya!